Hi, my name is Matthew Teninehouse. I've been with Peak Vista Community Health Center since 2013. Today we are going to tour the health centers at both International Circle and Printers Parkway. This is the second largest conglomerate of services and programs at Peak Vista in the Pikes Peak region. We provided world-class care to over 70,000 patients during the pandemic year of 2020 at these locations. 30,000 of those visits were for children under the age of 18. We strive for high-quality care and optimal treatment outcomes for everyone that is also affordable. So at International Circle, we have a family practice, pediatric health center, and a dental main structure. Over at Printers Parkway, we have a residency program, pain and wellness program, and a specialty support program services. So at Peak Vista, we really strive to look at 4 domains of health: mental health, emotional health, social health, and physical health. So I believe we address all those things through all of our wraparound services and support programs, as well as our actual health centers through primary care.
So right now we find ourselves at the Pediatric Health Center for Peak Vista Community Health Centers, the home of 11 medical providers, 3 BH, and 1 dental hygienist that together work in tangent to give a whole health approach to all the patients that come in and see us. So the Pediatric Health Center is accessible through our centralized call center located in the company main building using the 632-5700 number. Once you call them, they're able to make you an appointment at our locations here for either medical and or BH. So we find ourselves in the hallways where we can see some of the medical providers' rooms. Each medical provider has 3 assigned rooms that they alternate to see patients. They do this with the help of our awesome MAs. So as you can see, the MAs are currently facing to the west side of the building. Each of the MAs is assigned to their medical provider, which has their own office on the right-hand side.
So I'm Dr. Vance, and I'm a pediatrician here and also the medical director. One thing that's really nice about having so many clinics close by is that patients can have all their healthcare needs met close to home. So the parents could, even though they don't come to our clinic, could be in the clinic right next door, so they might have an appointment there, and then their kids could have an appointment here. We also have dental health integrated right into our clinic.
So we went through a lot of different ideas to try to work together alongside with BH and dental. This clinic as a whole came up with the solution of a flag system to be able to identify if the child is in need of BH. For example, they will put the blue flag up, or dental, they will put the white flag. Allow me to introduce Dr. Stacy Romero Wilson. She's one of the pediatricians here at the clinic.
Hi, I'm Dr. Romero Wilson. I'm lucky enough to work here at Peak Vista. We can see up to 30 patients a day, so lots of fun and laughter and sometimes tears, but we're growing happy, healthy children to our best of our abilities.
And here we have the nurses. They help us on a day-to-day activity. Asthma teachings and other scenarios might present themselves. Here we have the First Visitor program, which is another program that works alongside with the clinic. And this program dedicates themselves to helping parents learn how to have their babies in a safe environment at home.
Hi, my name is Miriam Pantoja. I'm one of the family support care managers with the First Visitor program. We provide educational materials. We also help them with any community resources they need, like financial, medical, or legal assistance. And also we help them with diapers, baby formula. Of course, everything is based in donations. The only requirement is to have kiddo under 5 years old, and they don't need to be Peak Vista patients also.
Completely free to everyone, and you don't have to be a Peak Vista patient. As long as you have a baby, you qualify. Allow me to introduce Dr. Barbara Divish. She's one of the pediatricians here at our awesome clinic.
Yeah, I'm Dr. Divish, and I'm a pediatrician here at Peak Vista at International Circle. I've been a pediatrician here for 12 years and continue to love it. I love the patients that we serve, the challenges, everyday challenges of healthcare delivery and taking care of my families, and just always enjoyed my job here.
One of the awesome programs that we have going on every year is the back to school backpacks, completely free to our patients, and the only requirement is they're of school age and they come in and get their back to school physicals, and as a reward they get a backpack full of school supplies for their school needs.
Hello, my name is Miriam Garcia. I'm the Dental Operations Director here in Peak Vista. I'm in the location of Dental International Circle. We have a wonderful behavioral health services in clinic available all the time, the same as the registered nurse care coordination. With that being said, we are able to serve not from the dental perspective, but also from the behavioral health perspective and also in the social perspective. I'm more than happy. Please join me. I'm gonna give you a tour today. I hope you enjoy it. So thank you for coming to the tour. As you can see, this is the main entrance. This is where we have our wonderful staff. We have the receptionist and call center here to serve our patients. As you can see, this is where we can welcome the patients, and this is where they can do the check-in area. And on my back, you're gonna see we have the checkout area, and pretty much is so we can make a smoothest transition and harm one off for the patients. So this way, while the patient is checking in, at the same time, we're gonna have the patients checking out. As you can see, our rooms, they are pretty spacious with high technology. Peak Vista is constantly, we are investing just to make sure that we have the infrastructure needed for our patients. We can do extractions. Also, our providers, they can do fillings, they can do amalgams. Also, they can do even prosthetics, which we can include dentures as well. Also in here, in this office, this is where we have our behavioral health services provider.
Across the nation, it's a kind of a new wave that there's a close association between behavioral health and dental health. There is a lot of crossover, so yes, we see a lot of people that have avoided the dentist for many years because it does give them some anxiety. But if you think about it, like somebody that's very depressed might not have taken care of their teeth. There's a lot of crossover between like substance abuse and your dental health, or just down to kind of managing your oral hygiene.
So, and now we are in one of the operatories, and this one is from the hygienist. Same, those are pretty standard. And the procedures that the hygienist can perform is what we call the SRPs, which is a deep cleaning. Also, they can perform what is the periodical cleanings. Patients really enjoy it, and also they are really committed to come to their appointments as well.
I'm one of the hygienists here at Peak Vista. I really enjoy being here and working with all of the patients that we get to see, especially those who usually haven't seen a dentist in quite a while. So it's a great privilege to get to see those.
Right here we do comprehensive, anything from routine care to comprehensive dental treatment. See about roughly about 16 patients a day. Every day is a different day. You know, there's no day that's the same.
Well, hello, I'm Dolores. I'm an EDA. You may be asking yourself, what is an EDA? An expanded duties dental assistant. We're able to place fillings, pack cord for crown and bridge, and assist the doctor as well.
So, and in here, we're gonna find the pediatric room itself. So, as you can see, we have a TV, so this way we can keep the little ones entertained. And at the same time, we have some models of kind of puppets, so this way we can show them how to teach. And also, as you can see, it's pretty spacious, where the parents, they can join and ask all the questions to our provider, so this way they can follow instructions better.
Hi, welcome to Peak Vista Health Center at International Circle. My name is Sierra. I'm the manager here. I have Tara and Jesus, and this is my reception desk, and where we check in all of our incoming patients for their medical visits, their behavioral health visits, and our lab services. All right, this is Victoria, our behavioral health provider here at International Circle.
Hi, I offer behavioral health services, supporting people with stress in their life, managing emotions, changing their habits to be healthier.
This is Anidra. She is my lead medical assistant here at International Circle.
I've been here about 4 years now. I'm currently the primary medical assistant for Dr. Fisher. We also have Hannah Pinchek here. We have a pediatrician here, Dr. Lombardi, and we have Lori Downey, and we have 4 other MAs that work here as well.
I'm one of the nurse practitioners here at HCIC International Circle, and this is Paris, my medical assistant. Here we do Nexplanon inserts, we do IUD inserts, so we do a lot of the birth control management here that's outside of women's clinic.
Hi, I'm Dr. Lombardi. I'm one of the pediatrics here at Peak Vista Community Health Centers, our International Circle Clinic. Nice to meet you. Here I offer services to ages pretty much from newborns to they're 18 years old. We see any type of patient, and we take all different insurances, so just know that we want you to have access to your medical care and no barriers when you come in to see us, and that we're going to treat every patient with the highest quality we can possibly offer.
My name is Sandra. I'm a resource navigator here at Peak Vista. My job consists of helping out the patients. I get resources for transportation, food, housing, things like that.
Hi, my name's Jenny. I'm a team nurse at Peak Vista at International Circle. I work closely at care coordination, so that means that if you are seen at the hospital and then you are discharged home, that making sure that we get all the information so that we get you coordinated with, your specialty, or following up with your provider to make sure that all your things are taken care of.
So in addition to taking care of patients, we're a part of the Peak Vista Family Residency Program. So all of the residents spend 2 months doing primary care pediatrics. So that's to prepare them to go out to the world and take good care of children when they leave here.